The most common organism causing neonatal sepsis is Klebsiella. In India, but in worldwide, it is group B streptococci. There can be two types of neonatal sepsis. One is the late onset and the other one is the early onset. Early onset and late onset. Now, early onset occurs within 72 hours and late onset occurs more than 72 hours. This late onset is usually hospital acquired infection. This occurs due to unclean hands of the hospital staff. However, this early infection is due to pre-rupture of membranes. It can also be due to chorioamnitis. This early infection causes infections like pneumonia, and the late onset causes infections like septicemia, meningitis. So what are the clinical features in the neonate? Clinical features are very vague symptoms like poor feeding, poor cry, seizures, very rarely. If there is meningitis, then it can be seizures, there can be vomiting, etc. For the diagnosis, septicemia screen is done. Diagnosis, septicemia screen is done, or the sepsis screen. In this, blood investigations are done. Blood is taken, in which we see WBC is decreased, neutrophil is decreased. Then there is increase in immature is to total neutrophil count. And there is increase in ESR. So these are main sepsis screening. These three things come in sepsis screening. The blood investigation, WBC is decreased, neutrophils are decreased. Then the immature is to total neutrophil count is increased, and ESR is increased. 2 out of the 3 of these factors should be positive for saying it as sepsis. What is treatment? Empirical antibiotics can be given, penicillin plus ampicillin. Thank you. Like, share and subscribe.